Hello, beloved. Happy Wellness Wednesday. Today I have the privilege of speaking to Dr. Venne Willams as we discuss pelvic pain awareness and also mental health. It's interesting that a lot of us are unaware how it's a correlation between mental health and pain. So again, today we're going to break that down exactly how that looks and approaches in order to seek out a better quality of life. Temple Works is located on the beautiful island of St. Croix, U.S. Virgin Islands in Christiansted Town on Company Street. The ambiance is breathtaking in here, so serene. So we're here with Dr. Venne Willams. Can you tell us a little bit about yourself and how you became interested in this type of care?
Sure. I am a doctor of physical therapy and I specialize in women's health and pelvic care in addition to a few other specialties. This month is Pelvic Health Month as well as Mental Health Month. And Natasha and I are both doulas, but we took two different paths to get to becoming a doula. I became a physical therapist initially, and I branched off into becoming a doula in addition to pelvic wellness because of the close ties with pelvic wellness and awareness and prevention of pelvic injuries during birth, the postpartum care aspect of physical therapy, and the prevention of pelvic pain, the treatment of pelvic pain. It's a problem that plagues many women, especially in minority communities, and we both have different ways of addressing it simultaneously with mental health, as well as addressing it individually as a separate issue.
Awesome. So what she didn't want to tell you is I've known her for years. Her character, her work ethic, it all goes hand in hand with the type of care that she gives. And I love that you mentioned that we have two different approaches, but again, the goal is the same, where she comes from a medical side. And a lot of what I share with you all is more spiritual, but again, holistically, how they all go hand in hand. So before we get too medically inclined, she's going to share a little of the spiritual aspect and integrating that.
So with pelvic wellness and mental health, any health in general, any type of wellness, our souls, our spirit, our well-being on the whole is involved in our recovery. And while I do not promote any specific religion, if a patient or a client is interested in doing meditation or getting deeper within themselves to bond with their baby or to affect the positivity of their family, whether it's in conjunction with their spouse, significant other, or independently, there are other avenues that we take to support their spiritual wellness as well.
Awesome. Now, how can, because a lot of times it may be cliche to even discuss, but the trauma part about the necessity of making sure your pelvic health and your pelvic floor is intact in order for just proper healing. Because I think a lot of that, even as women, we kind of bypass that just because it's really a male-dominant medical world, so to speak, where, oh, she's a woman, she'll get over it. Oh, she's a woman, having a baby is natural.
Right, she's strong, she's gonna get over it.
And though these things, it may be natural, it's still certain care that you would kind of want to implement in your life because not everybody's able to bounce back, and society sometimes makes us feel if we don't, something's wrong with us. So a lot of these things we suffer in silence.
Correct, and that's where a support system, whether it's friendship or your medical team, can also assist. As far as the mental health aspect goes that ties into pelvic wellness, pelvic pain is a source of depression for many women. And in conjunction with postpartum depression, it can become a severe problem because depression would continue to feed the pain and it becomes a cycle. Depression, pain, and the crescendos into something that becomes unmanageable if you do not seek assistance.